Hi, this is Kelly, and you're watching Reading Between the Legs. This is honest talk on sex, health, and soul. So, last episode, I talked a lot about the influence that media has on sex and our relationships. So, to somewhat stick with that same theme, I'd like to talk about a woman's body image and how it can be influenced by things like media and also just other people. And no, I'm not talking about a person's weight or the thigh gap. I'm talking about the vagina and the female genitals in particular. Hence the name of today's episode, Designer Vaginas. So before I even get started, I just want to talk briefly about some comments I got last week. They didn't really upset me at all, but I'm kind of amazed at these comments. So basically, I don't know if you saw it, but I posted a drawing of three very different looking vaginas, that I found from this local sex positivity group here in Massachusetts. It's called Pleasure Pie. Check them out. They're amazing. But this photo was purposefully posted to draw some attention because I'm trying to, get some listeners. And the point really was to show photos of very different looking vulvas, which are all very normal, but they're different. And that's really the purpose of today's episode. Like, I'm trying to talk about differences and different types of normals. I got some crazy, weird, shocking comments like, ew, gross. Why am I seeing this? This is nasty. Oh my God. Things like that. I think I'm amazed because it wasn't men that made these comments. It wasn't even like my 13-year-old nephew. That's a boy. But it was grown women that made these comments. And really, this is my exact purpose. This is the purpose of my life, I swear. It's to change this taboo we have of photos, like the reproductive system, sexuality. Why is a photo of drawn vulvas gross? It's a part of your body. Especially these people that made these comments. It's a part of your body. You have this. And most females have this underneath their, jeans or pants. So I wanted to share that with you guys because I want you to know I'm not here to gross you out. I just want to help educate you about what's normal, what's not, how to care better for yourself, both in body and in mind. So I guess I'm warning you right now, I'm going to talk a lot about vaginas and vulvas in this episode. Now, I don't necessarily have a really good personal story to tell about media's influence on my body image. I think in the back of my mind, especially when I was younger, I would look at women in the media and think, well, crap, I don't look like that. I kind of wish I did. But body image really wasn't something I particularly struggled with, especially when it comes to being concerned about what my vagina looked like or what it felt like. But I'll tell you, I get questions constantly from my patients about their vaginas. Like, is it normal? What's wrong with it? It didn't look like this other picture I saw. Or I thought I was weird because it didn't look like the one, or my boyfriend made a comment about it, or I feel like it's too loose. I get that all the time after a woman delivers. People ask constantly, there's an obsession over vaginal, discharge and what should it look like, or why do I have it? I have patients that I feel kind of obsess over the smell of things all the time. So let me first talk about the subject of vaginal appearance because it will answer a lot of these questions. If you have a vulva, which is the external genitalia of a female, that has one vaginal hole in it, it is most likely normal. Every woman's vulva and vagina are very different. Just like our noses all look very different. They have different lengths, they have different widths, different shapes. Some have a lot more hair on them than others. Not all labia look the same either. So the labia majora is what people call the outer lips. The labia minora is what's on the very inside that covers the vaginal opening. So everybody has different shapes and sizes of those too. Some have very long labia minora, some have very short labia minora. All vaginas have different odors. And every woman that has a vagina, except some older women after menopause, have discharge. And that is very normal, very healthy. There are so few photos of vulvas and vaginas in mainstream media, which I understand. We have to be cautious of what we put on TV and in movies. But a lot of images that we come across are in pornography, actually. Men and women both come across those photos. There's very little diversity in the appearance of vulvas and vaginas in pornography. And some are actually digitally altered to appear more clean looking, whatever that means. Or to just like appear like very small slits, I guess you could say. That and like the very few pictures we see in sex ed or in books are about the only photos women have to compare themselves to. So I've read a couple research papers recently, and there was one that talked about this direct link between our exposure to media and how we feel about what's normal and beautiful. So we basically have based our beauty ideals on what somebody else has told us is acceptable. So we're seeing a vagina in the media, whether it's pornography or if you're searching on Google, what does a normal vagina look like? Or even in some books, I've looked at photos in some of like sexual education books, and really there's just a one drawing, not much of a array of differences. And then they add in, you add in the vaginal health products that are put across advertisements, and we think that's what we should look like. That's how I should take care of myself. So one of these research studies actually related to normal vaginal appearance, and it questioned young women ages 16 to 18. So most of us know that's a very impressionable age. And so they asked, what are your views on what's acceptable, and where did you get this information and for the comparison of what's acceptable? So many of these young women actually said that they had no clue what was actually normal because they had very little to compare it to. When shown pictures of different vaginas and vulvas, they were way more likely to say that the hairless vulva that had no visible labia minora was way more socially acceptable, and the vulvas that had hair or had any protrusion of the labia looked unclean and were most likely unacceptable. Most of these girls didn't even know where they got this idea, what was acceptable and what wasn't. Although the internet was the number one source of information for these women as what they compared themselves to. So they saw something on the internet, they said, well, mine doesn't look like that, or mine does. And that's how they made this comparison of what was acceptable, what wasn't. They rarely found anatomically correct pictures of vaginas, and rarely also did these vaginas even look realistic. Pornography was cited to have the most influence on men and women as a perception of what is ideal and acceptable female genitalia, which, of course, is not an accurate depiction of most women, especially us now knowing, because I read about this, they're digitally altered. So it's clearly not a realistic view when we're, photoshopping what a vagina should look like. So this brings me once again to the importance of sexual education. Education about genitals and their diversity is very important so that young women can understand what is normal and what is not. Very few books show different types of normal. Many, like I said, just show a drawing and not even an actual photo of normal vaginas. So of course there's all this confusion about what a diverse range, that there even is a diverse range of the appearance of vaginas and vulvas. Men and boys could benefit a lot from education about this diversity as well. Just as women should be learning about how not all penises look the same, because they don't. So it's good to know, hey, some, they all have a very different appearance. If men had more education about this, they would be way less likely to make some judgments, and some even make comments to a woman about how their appearance is either normal or not normal. I read in another research paper that negative comments from a male, specifically a male partner to a woman, is directly related to her satisfaction with the appearance of her own genitals. That satisfaction is directly also linked to a woman's sexual satisfaction, which is so important because it really does play a role in a woman's self-esteem and self-worth in her own relationships. Because of this distorted view of what the ideal vulva is, some women are actually going as far as surgery to create this perfect picture, this designer vagina. Hence the name of this episode today. So there is a recent rise in the request for vaginal reconstruction or rejuvenation. Some women will have what is called a labiaplasty. So basically they have the inner lips, which is the labia minora, cut or shortened to make them smaller appearing and less loose looking. Vaginal rejuvenation is a procedure that actually surgically tightens the vagina. They use a laser basically, and somehow, it's a long description of how they do this, but they use a laser to help the tissue rejuvenate. That surgery can actually be really helpful for some women that have problems like urinary incontinence. Some can help with prolapse of the uterus or the bladder. So it has good ways it can be used. But in this way, it's being used for aesthetics only. And none of these procedures come without risk, just like any kind of surgery. There's possible total loss of sensation. You could have chronic pain problems in the vulva and vagina. There's always risk of infection anytime you have surgery. There's risk of adhesions and life-changing scarring. There's absolutely no evidence out there that these procedures enhance sexual experience or satisfaction. Now, I understand that the psychological reaction to this surgery is probably way more important to a lot of women because they feel better about how things appear. And I understand that, but is it really worth all of those risks just because you think what you look like isn't normal, when in actuality it probably is very normal? So the American College of Obstetrics and Gynecology, which is also known as ACOG, has made a statement that these procedures are not medically indicated, nor is there any documentation of their safety and effectiveness. Except for, like I talked about before, there are some uses with incontinence and prolapses. They also state that the procedure is very deceptive and has no real benefit, especially compared to the possible risks. So, I have heard of these procedures in very limited, I know very limited about them, but with what I've read, to me, I feel like it's just not worth the risk. How about we talk a little bit more about what's normal, what isn't, and all the variations of normal. So to address the other question I get so often, it's around vaginal discharge and vaginal discharge odor. There are so many types of infection that can cause abnormal discharge and odor, and those obviously all need to be addressed. But some thin white and clear vaginal discharge is totally normal, and it has a little bit of an odor. It shouldn't smell like roses. It changes throughout the month as well, like in amount and the consistency based on the menstrual cycle, because during ovulation it changes a lot. Discharge is very healthy because it actually means that your vagina is doing its job, what it's like part of what it's supposed to do. It cleans itself. So I listened to this TED Talk once by a popular women's health physician, And she actually compared the vagina to a self-cleaning oven. And that's a perfect analogy. I actually use it all the time at work to try to explain to women vaginal health and how it takes care of itself. There's very healthy bacteria that's present in the vagina. It's called lactobacilli, and it helps control the overgrowth of bad bacteria. So the discharge is actually like the flushing out of all of this bacteria, leaving your vagina constantly clean, and it's doing that by itself, and it needs very little help from you, actually. Some odor is also very normal, but more often than not, at least in my experience with my patients, women trying to get their vaginas to smell like flowers or the Caribbean Sea is actually what can cause a lot of infections. Douches and scented soaps are very bad for your vagina. They throw off the pH, they kill off all this good bacteria, and it can leave this bad bacteria to overgrow. This bad bacteria can cause vaginal infections such as yeast infections or what's called bacterial vaginosis. So they're really common. They can be caused by other things, but they are miserable infections. And if you can avoid them, you would want to, because they can cause a lot of itching, irritation, very abnormal looking and smelling discharge, as well as some pelvic discomfort and like really bad cramps. So honestly, and I'm more than aware that this sounds strange because I get weird looks from my patients all the time, but you really only should use warm water to clean your vagina. And there's absolutely no need to rinse out or like scrub the inside of it. If you're a healthy person, it's going to take care of itself, I promise. I had a patient that once told me she would take a soapy washcloth and actually shove it inside her vagina and scrub to clean it. And she had constant yeast infections. There's a reason. It's not necessary. If it creeps you out not to use soap, I get it. Just make sure it's unscented and has very little chemicals. Don't use your Bath and Body Works soap that smells like vanilla or cherry blossoms to clean and wash your vagina. Plain white Dove, Ivory soap, something similar to that, works just fine for that area. Use the smelly good stuff everywhere else on your body if you can, but just not in that area. It's just not good for the pH and the good bacteria that lives there. Now, if you do notice like a sudden change in the amount, the appearance, the odor, see your doctor, please, because, it could be one of the infections I just talked about, but it could also be an STD that actually causes that. There's a lot of STDs out there, and the first symptoms for women is usually a change in their discharge or the odor. So do not let it go. My confusion with all of these questions is always, why don't these grown women know that discharge is normal? Why do they buy these products to make things smell better, to look better? They try to get rid of their discharge altogether, which is impossible, and you would not want that, trust me. Well, have you looked in the women's aisle in the pharmacy lately? Or like at Walmart? Because it is full of vaginal washes, wipes, products to make things smell better. We also get this idea that we should be like hairless. So there's like wax kits everywhere, razors, trimming products. Now, I'm not judging. You do whatever you want with your vagina. I'm just trying to tell you what's safe and what is healthy. And no way in like taking care of your genital area is wrong. I have patients all the time telling me and apologizing to me for like not shaving down there before their exam. But everything's okay. Like, it's all good. Now, shaving too much and actually waxing is not as bad as some other things, but shaving too much can cause a lot of irritations down there in the vaginal area, but it can also cause some really bad abscesses and infections. So just be really cautious. Make sure you're cleaning things well before and after shaving. You keep things clean and dry. It's really the best way to do that. I just want you to be healthy. I mean, that's really all I'm trying to tell you here. Take care of your body, and it will take care of you. Keep yourself clean, but don't go overboard. And please do not compare your anatomy to other women in porn, magazines, a lot of the images online, which are not at all diverse or normal, because they're not the only normal looking ones. And if you're concerned it's not normal, go to your doctor and just ask. I get this question a lot, and there's nothing to be embarrassed about. You want to make sure you're healthy and you're normal, and that's really all you should be doing. You should be empowered enough to say, hey, I don't know what is normal, so can you tell me? It's not the first time any of us have heard that question in women's health, I promise. And you need to be comfortable in your own skin. So if someone else telling you that it's normal will make you feel better, do it, please, because you should be comfortable with yourself so you can be comfortable with others. So this all really just comes back to sex education. I truly believe that if we were more open about reproductive and sexual health education throughout the lifespan, we would be way better prepared to understand our bodies for what's normal and what isn't. You know, we talk a lot about diet and exercise, preventing diabetes, preventing heart disease, but we talk very little throughout life about vaginal health and appearance and what's normal and what's concerning. I think that if more people understood this wide range of what's normal, we could totally get rid of these thoughts of what vagina should look like and just embrace what we have and enjoy what we have and what we've been given here. So that brings me to my next episode. I am going to talk about sex and reproductive education. I am very aware that sex education is a controversial topic for some, and I promise I'm not just going to be spouting off like my opinions about it. My goal in the next episode is to bring you facts so that you can understand why I feel the way that I do and why I'm so passionate about trying to increase our sex and reproductive education. So before that next episode, I want to know how you feel about it. So I'm going to be putting out a new survey on SurveyMonkey because I want to know where and how you got sex education. I'd like to know your thoughts about it. I want to know what questions you might have about it, especially if you're like a parent and you're trying to figure out, how do I include this in conversation with my children? I would love to answer some of those questions. So please keep your eyes out, because the next couple days I'm going to be putting a link for this on my website and also through social media. And I would love for you to fill it out, be as honest as possible. And also it's going to be anonymous, so it's not like I don't really care. I care how you feel, but I'm not going to be judging you because of how you feel. I just want you to be honest because I want to answer the questions that you have, and I want to address whatever I see in this survey, because you're the ones listening, so you're the ones I want to talk to. So thanks so much for listening today. I know it may have been a little uncomfortable for some people, but the more you listen, the more you talk to others about it, I promise it does get more comfortable. Also, don't forget to sign up on my website. I send periodic emails, reminders, things like that. And also follow me on social media, Facebook, Instagram, also on Twitter. Just search for Reading Between the Legs. Thanks so much, guys. I really enjoyed today's episode, and I really hope you do too. Have a good day. Thanks. Bye.